Hi everyone, I'm Jenny Rogers and I'm going to be talking to you today about C-sections and C-section scar management once we get home from the hospital and delivering our baby. So we have vaginal deliveries and we have C-section deliveries. And those C-sections sometimes are not what we expected or maybe not what we planned. Maybe they were what we planned, but there's a lot that can go into managing that pain and helping to restore that muscle activation and tissue quality. When they do a C-section, they cut through your skin and all of the layers of the muscles and through the uterus to be able to get to that baby. And then afterwards, they have to close up all of those layers. So it is very important that we address all of the layers and that scar tissue. A lot of times with C-section scars, with it not being something that we always expect or plan or hope for, there can be a lot of emotions that are tied with it. A lot of times people will put a little black box over the C-section, trying to not look at it or touch it because it's hard to accept it as part of our body again. That tissue looks different, it feels different, and a lot of times it's painful. But the longer that we keep this little black box on this area of our body, the more difficult it is for our abdominals to return and to be able to activate. So the first thing I like to start with is talking about how we reframe this area in our brain. So instead of thinking about it as a place or a procedure that we didn't want, start changing that mindset of thinking of this is a place that your baby got to enter the world. It was more of a gift of where you got to see and hold that baby for the first time and just how they entered this world. So start viewing it as a gift rather than something that we didn't want, right? Even though sometimes that's not the first choice that we would have. So the first thing I'll have people start doing is just beginning to look at that C-section. If it's difficult and we don't feel like it's a part of us, just doing a little bit of looking, whether it's in a mirror or in the shower, and then trying to lightly begin to touch it. A lot of times that scar can be really sensitive. It can be sensitive to clothes, whether it's your shirt or your high-waisted spandex or your jeans, or if you're holding baby and baby is bouncing on your tummy, a lot of times it doesn't feel too good. So we want to start desensitizing that tissue so that we don't mind when something touches it, or if we bump into something, it's not super painful. Because when our body experiences pain, our response to it is to clench, guard, and protect this area because we want to keep it as safe as possible. So the first place we start just desensitizing it, once we are able to look at it in the mirror, we start lightly touching it. So I have my own C-section scar that I have added on today just so for this demonstration. It's not in the right spot because that's my belly button, but this is going to be the best I got for this video. Okay. So first, I want you to try making small circles above the C-section and below the C-section. If being close to it is difficult or there's a mental barrier over it, even start with just trying to pull your skin away from it to try to get that tissue moving some. Okay. If that's okay, I want you to start touching it very lightly, just starting to teach it that this is not a scary place, this is safe. And you're trying to keep those pain levels below a 3 out of 10 the whole entire time. If that pain is going above a 3 out of 10, tends to take me to the ER. If it's going above that, our body's response is going to be to clench and protect, and it's going to make it more difficult to address that tissue. So if you can tolerate something lightly touching it, then I want you to try desensitizing it to different materials, starting with softer things like a tissue or a cotton ball, and then slowly working your way up to rougher materials. So like a washcloth or even touching it with jeans. So I have here a little piece of tissue paper or toilet paper, and you can do the circles above it, below it, and then working on actually touching the scar, going in both directions. So pulling across one way and then working and going the other way. Okay. Once you can tolerate something that's a little bit softer, you can make it more challenging by doing deeper pressure. So pushing into your tissues more, above and below and on. And then you go to rougher materials. So now I have a paper towel to use, going above and below and across. Okay, going both ways. And then you can go all the way to a washcloth. Same thing here, working above and below and across. Okay. Another thing I like people to do is to break up those adhesions by using your fingers and going in an up and down motion across. This can help get that tissue moving a little bit better. So you're taking your fingers and you're going up and down. Get them close together, far apart. Just getting it used to having things move. Okay. And then again, the more pressure you can tolerate, the better it is at breaking up that deeper tissue. But if you're having pain, stick with the light and we'll slowly progress to working deeper. Okay. The next thing I like to have people try, but not everyone is a huge fan of it, so sometimes they just leave it up to the physical therapist to work on it, is picking up that C-section scar. So it's very bold and can take some time to get used to. But you try pinching up and picking up that C-section scar. A lot of times this isn't going to feel super fun the first time, so you can just do it lightly. And this is going to break up those adhesions that's keeping that C-section really stuck down. But those are adhesions are things that keep those abdominal muscles deeper from being able to activate super strongly. So we're working on breaking up scar tissue to get it back to as much as normal as possible. We'll never be able to get our skin and our tissues and our muscles back to 100% the way that they were, but we're going to work on it to get it back to as normal as possible so that this area is not as sensitive, it feels more a part of us, and our muscles are able to activate as strong as possible to support us through all of our daily activities, whether that's picking up baby, picking up laundry basket, getting in and out of the car, whatever it is. So work on this for about 5 minutes a day. Try to think of it as a task that you would do every day, like washing your hair in the shower. You can easily work on C-section with soap and water when you're in the shower. And you can do it after you brush your teeth. So trying to set aside that 5 to 10 minutes, just thinking of it more as a daily routine rather than something you have to find a lot of time to set aside. But that is all I have for you. Thanks for joining us on how to take care of our C-section scars.